the history of this is that we were, like I guess a lot of people, a lot of professionals in the field, really trying to understand this emerging science, the huge number of research reports, the excitement in the clinical field about the impact of trauma and early adversity on children. And there were two aspects to that. There was the impact on the brain, the developing brain, so there's massive research about that. And there's a lot of research about the developmental consequences over time of how adverse experiences and trauma is affecting the development of children and adults. So we were grappling with this. We were doing training for our workers, trying to work out what they liked, what was meaningful to them, and that became the quest. What of this rapidly growing field is of relevance to direct care workers? In other words, people who are working with people affected by trauma, but do not have the professional training and sometimes the professional skills for working with that group. They often feel disempowered. In fact, the more we see these big textbooks coming out, the more you get the sense that this is only the domain of the experienced or the professional. So the quest has been for us, what is the essence of the trauma message? What are the key points that we need to know? What's the core of the message? And so after a lot of thinking, research, experimentation, we came up with the idea of the three pillars. Now, we didn't invent the three pillars. Bessel van der Kolk essentially invented that notion. He didn't call it the three pillars, but he has a wonderful little quote where he says something along the lines of, when we're working with traumatized people, we need to ensure their safety, and we need to have a good connection with them, and we need to help them manage emotions. So the idea, that sparked the idea, what is that the core message? And so we looked at other researchers, and there is some difference. Some people have slightly different opinions, even though there's a lot of agreement as well. So we decided, I then wrote a paper called The Three Pillars of Trauma-Informed Care. And that was the first time we put it out there. And we were surprised actually at the response, because there's been a very large response. And I think it's not at all because the content is startlingly new. It's not. It's probably just the way it's framed and presented that has made that difference. And so we put that paper out, and in fact the journal called me and said that paper generated more requests for reprints than any of the other papers in the history of their journal. So obviously it touched a chord with people working in the field. And so we called it The Three Pillars of Trauma-Informed Care. The reason we called it that is because that was the generic term that was going around the field. Trauma-informed care, trauma-informed schools, even trauma-informed youth justice, trauma-informed everything at the moment. So that was the term that we used. Now, one of the difficulties has been that other organisations have arisen all around the world calling themselves trauma-informed organisations. In fact, in the US, there's even an institute, a prominent institute called the Institute of Trauma-Informed Care. And there's, like I said, there's virtually everything now has trauma-informed in front of it. You know, trauma-informed child protection, that sort of thing. So it was at that point that some people weren't sure, when you say trauma-informed, exactly what do you mean? Do you mean this particular school of thought, or that school of thought, or this school of thought? And so that's when we decided that we would differentiate it. And in fact, we called it trauma-wise care, right? It meant exactly the same thing, but it was a marketing device by the organisation that we worked for, right? Which was called Star Commonwealth. And they had a training wing. So they copyrighted the notion of trauma-wise care. All right? So we went with that, but only in America. We didn't use that in Australia. In Australia, right from the beginning, we've used the word transforming care. The reason we did that is because, you know, in English, transforming has a dual meaning. So not only are we transforming care, but hopefully the kids are transformed in care, you know, so it has that dual meaning. So when we no longer working with that, organisation split off in the US. They had, you know how organisations, someone else takes them over and things like that, and we decided that we wouldn't work, we're no longer working directly with that organisation, although we're working with many of the people that were involved there. So we decided we would just revert to our original title, which was Transforming Care. We always preferred that ourselves, but in a sense, it's exactly the same content, right? It doesn't mean anything in terms of the content difference. So now we've aligned, and so in Australia, where this course is quite widely used, they've always known it as Transforming Care. So in Australia, it's called the 3 Pillars of Transforming Care, and that's what it's called